on the Blease anaesthetic machine used as part of IAC testing. Firstly, check that the power supply for the anaesthetic machine, monitor and ventilator, if applicable, is plugged in and switched on. Ensure that the anaesthetic machine is switched on at the front. Then check that each pipeline is securely attached to its supply using a tug test, suction, oxygen and nitrous oxide, as well as air if being used in the anaesthetic room. Follow these pipelines into the back of the anaesthetic machine and check the non-interchangeable screw thread to ensure secure attachment. The pressure of each pipeline now needs to be checked on the pressure gauges on the front of the machine and should be at 4 bar or 4 times 100 kPa. Next, check that an alternative gas supply in the form of cylinders is available on the back of the machine in case of pipeline gas failure. Oxygen should always be available, with the option of nitrous in addition. Each cylinder should be turned on in order to check the level. Some cylinder keys will show which way to turn on the cylinder by showing an on-off engraving on them. If not, turn the cylinder on fully so that you can be sure which way to turn the cylinder off completely after checking each level and thus avoiding exhausting the cylinder. For oxygen, a level above 50 times 100 kPa is acceptable. If lower than this, the cylinder must be replaced. The nitrous cylinder will show 44 times 100 kPa. Note, however, that this cylinder level won't drop until the liquid state of nitrous oxide is exhausted and only gaseous nitrous oxide is left. Then the level will fall as the gas is used. The only accurate test of filling is to weigh the cylinder. Turn both the oxygen and nitrous oxide on fully throughout their ranges. Checking that each bobbin is spinning and not sticking within the tube. Do the same for air if being used. Then check the hypoxic guard is working, ensuring that a hypoxic mixture cannot be delivered to the patient. This is done by checking that the nitrous level drops as you turn off the oxygen and that the oxygen automatically comes on when turning on the nitrous. You may also note the oxygen flow meter never fully turns off and always delivers a minimum of 0.3 litres per minute. You can then leave the oxygen on 5 litres per minute for the remainder of the anaesthetic machine check. Check that the oxygen emergency flush is active. Check both vaporizers are seated properly and adequately filled. Check each vaporizer switches on throughout its range and that the interlocking system is working to ensure only one vaporizer can be used at one time. The back bar and the vaporizer now need to be assessed for any leaks. This is done first by occluding the common gas outlet with the vaporizer switched off. This should cause a pressure build-up in the back bar with backflow to the flow meters so that the bobbin drops and the pressure valve on the back bar releases. Then repeat the test with each vaporizer on in turn and the same response should be elicited. The breathing circuit, in this instance a Bain circuit, now needs to be visually inspected, followed by checking the integrity of each limb of the circuit. The inner limb running from the common gas outlet to tip is checked by using an appropriate device, little finger, plunger of a 2 ml syringe to occlude the inner outlet. This should cause a pressure build-up through the inner tube and the back bar, causing the bobbin of the flow meter to drop and the pressure valve on the back bar to release. The bag should not fill. The outer limb, running from the tip back to the bag and the APL valve, also needs to be checked. Close the APL valve fully and occlude the tip so that the bag fills without emptying. For a double bag test using a Bain circuit without ventilator and with the oxygen at 5 litres per minute, close the APL valve so that it is half open, using a second bag as a test lung, so that squeezing the bag on the Bain circuit will fill the bag attached to the tip. Now close the APL valve fully and switch off the oxygen. Squeeze both bags to ensure no leak. Inspect the angle piece and filter for any defects and attach to the Bain circuit. Check the oxygen analyzer at 21% for room air and 100% oxygen by putting the end of the analyzer into the common gas outlet with oxygen switched on. Blow into the end tidal analyzer tubing to confirm measurement of carbon dioxide. Check the continuity of the scavenging assembly from the APL valve as well as the ventilator, if applicable, to the scavenging unit and then to the wall. The float should clearly be seen and an audible scavenging noise be present in the anaesthetic room. Check the suction tubing and attachments before switching it on and occluding the tubing. A negative pressure of -60 kPa should be reached to exclude a leak. Check the availability of a self-inflating bag in the event of anaesthetic machine failure. This should be on the back of the anaesthetic machine. Check full monitoring is available, including ECG, blood pressure, and oxygen saturation probe. Additional equipment is also required, including your airway equipment, emergency drugs, and a tilting trolley.